The indications and contraindications to therapeutic hypothermia. Therapeutic hypothermia is also known as targeted temperature management. It's when you keep a patient's temperature at 32 to 36 in that range for 12 to 24 hours. Now, the indications for this are relatively few. You should do it in patients who have had a cardiac arrest after they have return of spontaneous circulation, usually after CPR, maybe epinephrine, and if they are still comatose. So that means that they have a Glasgow Coma Scale of less than 8. That's the indication for therapeutic hypothermia. There are some absolute contraindications. If the patient had a hemorrhagic stroke, you don't want to do this because the cold temperature can increase your risk of bleeding. If they have a Glasgow Coma Scale score of greater than 8, then therapeutic hypothermia is an unnecessary risk for a neurologically intact patient or a relatively more neurologically intact patient. Again, uncontrolled bleeding can lead to more of a risk because hypothermia impairs coagulation. Patients that have a hemodynamically unstable rhythm, hypothermia can worsen your cardiac instability. Patients that had trauma-related cardiac arrest, since the trauma-related complications can worsen. And there are a few relative contraindications. Again, a few bleeding things, coagulopathy, thrombocytopenia less than 50,000, prolonged cardiac arrest that lasted for over an hour, where the patient has a poor outcome likelihood. Hypotension despite the patient being on pressors and having received fluids, since hypothermia reduces cardiac output. Even if you do therapeutic hypothermia, there are a number of complications that you want to monitor. Low cardiac output and blood pressure, as we showed here. Cold-induced diuresis, which can induce electrolyte changes. Hypokalemia and hypomagnesemia specifically, you want to look out for. This can lead to arrhythmias. And having a suppressed immune system can put the patient at risk for infection.